I'm Dr. Carezani-Gavin from Azani Medical Spa. I am here interviewing board-certified plastic surgeon, Dr. Lamb. Welcome.
Thank you.
Thank you for being here.
Oh, thank you for having me.
And I would like to ask you, Dr. Lamb, who is the ideal candidate for a facelift?
Well, as you know, as we all age, we can develop some laxity in the skin area, most pronounced in the lower third of the face and also in the neck region. When we develop excess skin around the lower third of the face, you can start to develop a condition called jowls, which is an overhang the skin over the nasolabial fold right here. Okay. And excess skin in the neck, everybody knows if they have that. This is the perfect candidate for the facelift because it contours the lower third of the face as well as the neck. It tightens and gets rid of all the excess skin. Plus, as an added bonus, during the procedure, we tighten the muscle layer inside as an added bonus, so to speak, so that the longevity of the operation is that much better.
Excellent. Okay. And can you briefly explain the procedure, like how long it takes? Does it need general anesthesia versus local?
Right. So generally, I would say that the operation will be about 2 to 2.5 hours. I prefer the general anesthetic during the operation simply because it's a much better controlled environment for me. They're just very precise manipulation of tissue that I would want patients to be unaware of the entire situation. You know, basically, it's a great thing because when they wake up, the procedure is done and they go home.
Right. Totally pain-free,
That is
easy,
correct.
and it allows you to do the precise work that you need
That
to
I
do.
set out to do. Correct.
Excellent.
Yes.
Okay. And what can a patient expect during the recovery period?
So for the first week, they are going to be a little bit puffy. I'm not saying swollen, but just a little bit puffy and most pronounced somewhere around the jawline area, around the neck. There's going to be some slight bruising. We recommend a medication pre-op called arnica montana, which cuts down significantly on the amount of bruising, but it's still going to be, there a little bit. We use some light compression for the head and face to keep some support and also keep the swelling down for the first week. That garment I prefer patients to wear for about, anywhere between 1 to 2 weeks for me. After that, the swelling will probably dissipate completely by between 4 to 6 weeks.
So the average patient would need to be home or take a week off work for the average,
for the
about
average,
a week,
yes,
and then
absolutely.
they can maybe go back to a light schedule.
I think that would be absolutely reasonable. Yeah.
And pain-wise, can they expect?
Actually, it's surprising because on a scale of 1 to 10, most of my patients would rate it probably about a 4, maybe over 10, immediately, maybe for a couple of days. And then after that, it's really not that type of procedure where it's, that stimulating, shall we say. But, there's some soreness, no doubt, but it's really well tolerated for the most part.
And for the average patient, what's the longevity of the procedure? How long can we expect it to, quote, last?
Right. So that's the $64,000 question as always. Some of the factors that we can, sort of control is how we do the operation, how tight we pull the skin. Some of it is extrinsic, meaning that if the patient were to be a smoker, they have a lot of sun exposure and things. Those are the things that we can't really control through surgery. I have seen my patients get great results, up to 10 years, and they're very, very happy. But I can't fully answer the full
Depends
question.
on genetics, environmental factors, nutrition.
Exactly.
Yeah,
Exactly.
a lot of that stuff. But up to 10 years in
Up to 10
ideal
years,
conditions.
Absolutely.
Yeah,
Absolutely.
wonderful. Okay, great. Thank you for your expertise.
Thank you.
Okay.